Health and housing are complex needs in our community, as they are in many communities across our province and across our country.
For example, if someone's healthcare needs are not met, they may lose their housing opportunity, or if they don't have access to healthcare, they can't access housing. They are not having their other basic needs met, so they end up struggling in different ways.
In particular, through COVID, shelters were closing down, and Health and Housing came together to plan for how do we manage the health needs and the housing needs of someone in the middle of a pandemic. We learned a lot through that and found a lot of other gaps between how these two big systems were working or not working together.
We have a unique opportunity, and I would say over the last number of years, we've really seen how our services have integrated and been intentional about trying to deliver those services in tandem, recognizing that when you introduce the two together, the outcomes are much better for our most vulnerable community members. Our community has a very intentional plan around assessing the needs, and often that relates to a period of time during which someone has experienced homelessness in our community. And so in the absence of having permanent supportive housing programs, the individuals would otherwise have been accessing services elsewhere in our community, so either through EMS or at the emergency department.
Hospitals certainly face challenges that are unique to patients who might not have stable housing, in the sense that they may not have a safe place to go upon discharge. And a lot of discharge care requires someone to be in a safe, dry, healthy environment. People who are discharged from hospital need to be supported in wherever they are. So in particular, if someone is unsheltered or staying in different locations, it can be hard to kind of locate them, to provide the follow-up care that's needed, to have a physical environment that's amenable to their recovery.
I think the biggest impact that we've had related to the integrated health hubs that have connected 1,000 people in this community that have complex health and housing needs with ongoing health care. And many of those people are also connected with housing supports through that. So that's been a project that has had a huge impact. We've worked together to increase the capacity in our community for permanent supportive housing, where folks can live, but there are also 24/7 supports available. So in the last 2 years, we've had 108 units of permanent supportive housing, along with the supports, come online. And we have an integrated health team that serves all 108 residents across 4 different sites across youth and adults. And we've been building that together.
In the fall, we learned that there would be an opportunity for our community to support the development of a heart hub. And so because we were already working so effectively together, I think through the OHT, this was really done in collaboration with a number of partners. So the Guelph Community Health Center is leading that work, but Wyndham House and other partners have been involved in developing a heart hub model that, again, is going to be able to offer specialized integrated health and housing teams that are going to be able to do outreach and in-reach work with both youth and adults. And then we're also looking at opening more crisis respite beds for adults who need crisis respite opportunities, as well as bringing withdrawal management into our community, which is something that we've needed for a very long time.
I was asked to take part in the Health and Housing Symposium with Guelph Wellington on behalf of the Ontario Health Team and the PFAC. One of the things was our winter response, which was we had to act fast. Provision of basic needs, down to showers, sleeping arrangements, clean clothes, laundry facilities, like very, very basic needs. We're also doing a coordinated outreach. So people who are living in encampments, or the people that are listed in our accounts, that they are being regularly visited by outreach support that will help our community succeed.
The work that has come out of the Health and Housing Symposium will continue long into the future in our community. We've made great strides in the last year even to introduce new options for our community members, and we also know that we have a long way to go. It's also representation of some of our community members with lived experience who are helping then to inform the direction, which we know also then is going to lead to better outcomes for our community.
I think it benefits everyone having permanent supportive housing projects in a community, because we all want our community to be a safe and welcoming space for all. And we want all community members to have safe and stable housing and the supports needed to maintain that. So I think when everyone in our community has that, it ends up being safer for everyone.
I think that our system is working really hard to look at the data trends that we're seeing locally, and we are seeing that our numbers are quite a lot more stable than in other communities. So if you look at our inflow into homelessness, many communities are seeing an exponential rise, whereas ours is a little bit of a steadier, less exponential rise.
I believe that the Guelph Wellington OHT is being very intentional in supporting service providers to improve how we're integrating and how we're delivering services together. And we see that every day in the improved integration that is happening across our health and housing service providers.